Do you know the impact of methamphetamine use disorder? It might surprise you. Widely known for its highly addictive nature, methamphetamine is not only neurotoxic, but can also wreak havoc on multiple organs. The intoxication linked with its use often drives impulsive, risky behaviors, increasing the risk of contracting diseases like HIV and HCV. In recent years, the use of this damaging substance has seen an alarming rise. In fact, during the COVID-19 pandemic, the use of methamphetamine, along with other drugs like cocaine and synthetic opioids, saw a considerable upswing. The societal and individual consequences of methamphetamine use disorder are far-reaching. The most effective known intervention, contingency management, which rewards abstinence, coupled with a community reinforcement approach, has shown some promise. Yet, the damage caused by this substance is not only physical, but also mental and societal, making recovery a complex and challenging journey. The damage caused by this substance is not only physical, but also mental and societal. In order to understand its impact, we must first answer the question, what is methamphetamine? Methamphetamine is a highly addictive stimulant that is chemically similar to amphetamine. It takes the form of a white, odorless, bitter-tasting crystalline powder that easily dissolves in water or alcohol. But what sets methamphetamine apart is its potent neurotoxic effects. It works by flooding the brain with dopamine, a neurotransmitter that helps control the brain's reward and pleasure centers. This leads to intense feelings of euphoria, but at a high cost. Over time, methamphetamine can damage the brain's dopamine system, leading to a range of cognitive impairments and emotional issues. It also puts a significant strain on the heart and can damage other organs. Its use often leads to impulsive, risky behaviors, further exacerbating its destructive impact. So, as you can now see, methamphetamine is a potent and destructive substance. Overcoming methamphetamine use disorder is an uphill battle. This is a struggle that many face in the shadows, a fight against an enemy that is incredibly potent, neurotoxic, and damaging to multiple organs. The intensity of this struggle is compounded by the fact that there are no FDA-approved medications specifically for treating methamphetamine use disorder. However, this does not mean that there are no weapons in this fight. The most effective intervention currently available is contingency management. This is a strategy that uses rewards for abstinence, encouraging those battling this disorder to resist the urge to use. It's often combined with a community reinforcement approach, leveraging the power of social support in promoting recovery. The road to recovery from methamphetamine use disorder may be steep and fraught with challenges, but it's important to remember that it is a road that can be traveled. Despite the challenges, recovery is possible and there are effective strategies available. While the situation may seem bleak, there is hope on the horizon. Science is not standing still when it comes to the battle against methamphetamine use disorder. Researchers are constantly on the lookout for innovative and effective treatments. One promising avenue being explored is the combination of two medications, bupropion, typically used to treat depression and help people stop smoking, and naltrexone, commonly used to prevent relapse in those dependent on opioids or alcohol. A recent clinical trial showed some positive results, with an increase in methamphetamine-negative urine samples among participants. There's also the exploration of transcranial magnetic stimulation, a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It's already used in treating depression, and researchers are optimistic about its potential in treating methamphetamine addiction. Lastly, there's the exciting research into anti-methamphetamine antibodies. These could potentially prevent methamphetamine from entering the brain and producing its effects. With continued research and innovative approaches, a brighter future for those struggling with methamphetamine use disorder is within reach. In summary, methamphetamine is a dangerous and destructive substance, but there is hope for those struggling with addiction. This powerful drug, with its highly addictive nature and detrimental effects on the body and brain, continues to pose significant challenges for users and society as a whole. It's associated with risky behaviors, and its usage has been on the rise, particularly during the COVID-19 pandemic. Recovery from methamphetamine use disorder is not an easy path. There are currently no FDA-approved medications for treatment, making the journey even more difficult. However, methods like contingency management combined with community reinforcement approach have shown effectiveness. But let's not lose sight of hope. There are promising advances in research, from clinical trials investigating the combined use of bupropion and naltrexone, to the exploration of transcranial magnetic stimulation, and even the development of anti-methamphetamine antibodies. Awareness is the first step towards change. Share this video to spread knowledge and hope about methamphetamine use disorder.